If you are a female and you have been experiencing dryness in your vagina, this video is for you. Most women with vaginal dryness do not talk about it, even with their healthcare provider. They either try some concoctions to treat it, or don't even mention it to anyone since it's an uncomfortable topic. Some also say it's a natural part of the aging process. But you have to know that the first step in treating vaginal dryness is figuring out what's causing it. So, in this video, I will help you understand how and why your vagina dry up, which lead to the lack of vaginal lubrication, and possible treatment options so you can find the one that works best for you in order to keep your sex life enjoyable. Let's delve in. A variety of factors can cause vaginal dryness, from dehydration to inflammation and beyond. Vaginal dryness can make sex painful and lead to other problems, like tears and infections. Take note, as anyone with a vagina can experience dryness, but it's more common in those who have gone through menopause. Now here are 5 causes of vaginal dryness. The first cause is low estrogen. Estrogen helps maintain normal blood flow, vaginal tissue health, and moisture in the vagina. You can have low estrogen when you are breastfeeding, postpartum, or after delivery, and you can have diminished estrogen when you are on some types of birth control commodity, and then certainly when you are in your menopause. Also, cancer treatments such as chemotherapy and radiation to the pelvis can also lead to low estrogen and decreased vaginal lubrication. The second cause is dehydration. The cells in the vagina need to have enough water in them to function properly. Some soaps, dyes, perfumes, lubricants, and scented products have ingredients in them that draw moisture out of your cells. And some medications like antihistamines can also lead to dehydration. Also, if you've been exercising like crazy and haven't been drinking enough water, you'll be drier down there. Inflammation is another cause of vagina dryness. The chemicals in soaps, hygiene products, dyes, and perfumes can also irritate your vaginal cells and cause inflammation. So, if the hygiene products you use have ingredients that are irritating or harmful to the genital tissues, I recommend you avoid them. Again, infections can have a similar effect. Yeast or candida often presents as a burning or feels like sandpaper. When there's inflammation, it blocks 2 critical types of glands that are just at the outside of the vagina. These glands produce fluid when you're aroused, so if these tissues are inflamed, they don't function well and you won't get good lubrication. The fourth cause is aging. The process of getting older is complicated and can affect the whole body, as well as specific tissues and organs. One area of concern is what happens to the vagina during menopause, which can significantly impact a woman's sexual health. Aging vaginal tissues are by their very nature drier than the premenopausal state. Younger people have better blood flow, which is needed to create the moisture that comes through vaginal tissues. The fifth cause is vaginal microbiome. It is suspected that there is some kind of link between the vaginal microbiome and vaginal dryness and other postmenopausal vaginal symptoms, but this has not yet been confirmed. Also termed as vaginal flora or vaginal microbiota, the vaginal microbiome are the healthy microorganisms that colonize the vagina. And it is believed when there's lower levels of these microorganisms, which helps vaginal health, there is more symptoms of dryness. Take note, as stress and anxiety can have an impact on your sex life. Sexual interest can be driven by sexual pleasure, so can problems between you and your partner. If the experience is not as pleasurable due to less engorgement and slow response, and fewer orgasms, the interest falls over time. This somehow can lead to dryness in the vagina. Treatment for vaginal dryness depends on the cause. In general, drink more water and avoid infections or anything that irritates the tissues. But other helpful ways to address it include: 1. Strengthen your relationship with sex and with your partner. If your dryness is due to problems in the bedroom, communicating with your partner is key. Choose a time to have sex when you aren't too tired or stressed, and make plenty of time for foreplay. You might also try therapy, especially if you have low desire, low arousal, and you've tried everything else. There are great therapists for this, so consider that when your dryness has to do with sex. 2. Use vaginal moisturizers and lubricants. There are tons of over-the-counter moisturizers that can be applied every few days either inside your vagina or externally to the vulva. They protect vaginal tissue even when you aren't having sex by sticking to the vaginal walls, helping to keep them hydrated, and encouraging the body to generate natural lubrication. Lubricants help with dryness and pain during sex, offering an immediate relief. You can buy different kinds of water-based or silicone-based lubricants over the counter. Products like coconut oil and petroleum jelly work too, but such oil-based lubricants can damage condoms. However, there is no difference between lubricants and moisturizers, and usually lubricants are cheaper. But take note, lubricants should be used at least 2 times per week, and also with sexual activity. 3. Try Osphena. This is a prescribed oral medication designed to address the discomfort associated with painful intercourse and vaginal dryness. But be warned, as Osphena can be associated with a small risk of leg clots and adverse cardiovascular events, so it is slightly riskier than any of the local vaginal treatments. It is only administered for use when local therapies fail. By the way, you need to understand that whatever the cause of your dryness, you can find that one relief that best works for you among these treatment options. Let's continue with the others. If you experience problems with vaginal lubrication because of low estrogen, you may benefit from treatment with hormones. Hormone therapy will improve the health of vaginal tissues. The cells become plumper, moister, and thicker. Some hormonal therapies are local treatments. In some cases, doctors recommend localized treatments like vaginal estrogen inserts. Example is vaginal estradiol, which can be helpful in those who do not get benefit from lubricants, but the effect size or the amount of benefit is relatively small. Another example is prasterone vaginal. This is recommended when other local treatments fail and is likely low risk. The second hormonal therapy is the systemic treatments. If you're also experiencing symptoms such as hot flashes, an oral medication or a skin patch that releases estrogen throughout the body is an option. Both local and oral approaches can be used together to effectively treat vaginal dryness. To end this video, vaginal dryness is a common and frustrating condition. But the important thing to remember is, it can be treated. Have in mind that no size fits all, and the first thing you try may not work. If something doesn't work, try again and see a doctor for assistance. I hope this information enables you in your sex life. Also, please leave all your questions in the comment section, share with others, and don't forget to subscribe to the channel for more educating videos.